wanted to explain a term that we use in the medical world, and it's called infant dyschezia. And I want to explain that term because it's very common, and I've seen a lot of babies who come in with very distressed parents for something that is completely normal and maybe save you some time and some distress in your life. So infant dyschezia is essentially a baby's body learning how to poop. So there is a lot of coordination that needs to happen between the brain and the muscles and the nerves and the sphincters, all learning how to coordinate to get poop out. So baby's body has to learn how to do that. So in the first few weeks of life, it can look really distressing when they're pushing and they're grunting and they're turning red and they're crying and they're straining and they're squirming around, all trying to poop. But really, they're just trying to learn how to coordinate all that muscle activity to let themselves poop, and learning what to contract and what to relax and what the sensation feels like so that they can poop more effectively. Sometimes they'll be doing that for like 10-15 minutes and then they won't poop, and that's even more distressing. But if baby's having soft and loose stools, even with all of that effort, it is totally normal and typically is going to pass in the first few weeks of life. So it's nothing to worry about, but it can look really distressing, and I understand why families are stressed out about it. If babies are having hard stools, if they have blood in their poop, that is not typical, and that is something that should be evaluated with your child's doctor. But rest assured, if it's just the straining and the grunting and the pushing and the turning red, it's all very, very typical, and it will pass usually within the first few weeks of life. So hopefully a little bit of reassurance for you. Thank you.